My pleasure to welcome Dr. Sunil Jhangiani. He is the founder of Nutritionvista, a health management systems company. It's a pleasure to welcome you, Dr. Jhangiani.
Thank you, Amit.
Your focus for Nutritionvista is health management, health resources, diabetes and other related diseases, focused on employees and individuals. So, if you can help us understand why and how you started this particular service.
That's a very good question, and let me start by what is the current situation in India in particular and globally as well. You know, right now we are in the midst of twin epidemics of obesity and diabetes. And if you add heart disease and chronic lung disease, we got the 4 most prevalent non-communicable diseases the world has ever seen. Now, when you look at the progress medicine has made over the last 50, 60 years, and there have been numerous articles on this actually in the lay press over the last two weeks actually, that we human beings have finally found the fountain of youth. Everybody talks about how everybody is living longer, how everybody is living healthier lives. But you must remember that in the background there's a tsunami lurking, the types of which we human beings have never seen before. And that is mainly obesity, diabetes, heart disease, and chronic lung disease. And so what we did was, and if you go back and look at what is happening in India today. India, this is the 2nd decade of globalization. And if you look at what is happening in India, all the diseases that were common in the Western world are now prevalent in every nook and cranny of India. It doesn't have to be urban Mumbai, it doesn't have to be Chennai, it doesn't have to be the tier 1, it is tier 2, tier 3, and even in the villages we are finding a high prevalence of obesity, diabetes, and heart disease. And so what we decided was, about 4 years ago, we started a health services company, and it's basically on nutrition, wellness. And what we do is, our basic target is individual customers, and we do health risk assessments, which are a very important tool for us to find out individuals who are at risk. And number 2, we do risk factor reductions, which could be, how do you detect the risk factors, and then we attempt to reduce the risk factors. And of course, the last but not most important thing that we have been doing in India, and I must tell you, our work in India has been very fulfilling, because we find that the India healthcare providers are absolutely most willing to experiment with new models of healthcare delivery. They are ready to try out different things, how to bring quality performance measures into healthcare delivery. And that's what we have been advocating. And the other important thing is that we have to shift the healthcare system in India, not just in India, but actually globally, from a curative to a preventive model, from a specialty-driven model to a primary care model, to an integrated delivery system model. And that's basically been our focus of work. And I've been very grateful actually, and I've had the opportunity to go to the Tata Institute of Social Sciences, be able to speak at some of their conferences, go to the National Institutes of Nutrition in Hyderabad, and we have talked about different factors affecting Indian society today.
So when you look at your work and your involvement here in this country, obviously it's difficult to draw parallels, but it has taken so many decades to evolve. But there are some simple things that could be done in India to achieve similar levels of healthcare.
Right.
Okay, at the very basic level.
Right.
And that is what is missing. So what is the best way to propagate these?
Right. Actually, if you look at the latest Planning Commission report and the budget outlays, India has finally decided to allocate or double the amount that they have been allocating so far towards public health. So that is a positive finding. And number 2, there are numerous things happening, especially India has become a hotbed for public-private partnerships. And you heard that throughout this conference today. It was, today and yesterday actually. And if you go to see, that is one thing that India will have to move rapidly forwards to, the public-private partnership. And you heard from my good friend and mentor, Dr. T.G. Patel yesterday, where he is working on the the Sevak program, where India has the political will today to experiment with non-physicians delivering care at the local village level. And Dr. T.G. Patel and his group have put together a program where they are training non-physicians to deliver care in 26 actually villages in Gujarat. And the same is being done in certain areas of Rajasthan, and I'm sure there are certain amazing things happening in the southern part of India, especially in Kerala and Tamil Nadu.
What are some of the processes you put in place for better healthcare management for employees here?
You mean in the United States? Yes. Or in
the US?
Well, in the US, the good thing about the way things are is that although there's a high percentage of individuals today who are uninsured in the United States, and the number is almost 15%, which comes to almost 55 to 60 million individuals without health insurance. But I must tell you that the employer-funded health insurance system in America is working well. You have the Medicare system that is taking care of the elderly and those with chronic kidney disease. And then if you go to the Medicaid system that takes care of the poor, and the underprivileged parts, you have close to 85% of the population having excellent coverage. Now that needs to happen in India. In India, we have 1.5 or 2% penetration when it comes to health insurance. And I believe the new planning commission, the recent bill passed in Parliament has been that India has to go to a universal healthcare system. And it could be funded through employers, it could be a tax funded thing. And so India is finally moving in the direction where it aims to provide basic health coverage for every citizen, no matter what.
The complaint from people in India is if you're ill, right, or you're in an emergency, or you meet with an accident, right, you can go to a hospital, but you, right, can't be admitted until you have sufficient funds provided in advance. Right. And the counter argument, which others will make, right, those who run the hospital as well, if we, right, keep taking these cases, right, then eventually, very soon, we'll run out, right, of our right, funds, and, right, we'll have to close shop. Right. But there's insurance at a certain level, right, mostly with professionals working for companies. Right. But for the majority of the population, right, the condition of the government-run hospitals.
It has a pay-as-you-go thing.
Exactly. Right. So, right, is there, right, a way you think, to somewhere meet in the middle and try to, right, better solve this, right, problem? Right.
This is an amazing question you brought up. And what is happening in India? And everybody. At the conference, we talked about a number of issues where in certain parts of India, in the villages, the pay-as-you-go model doesn't work. Most of the individuals want to, talk about, if I use mobile services, I would rather pay at the time I'm going to use that service and instead of paying a monthly fee. So that mindset has to still change in India, but I must tell you when it comes to healthcare, and if you look at the health risk factors for Indians who are in their 30s, we have the lowest healthy longevity in the world. It's a dubious distinction. I don't want to talk about it, but it's true. Today, by the time you're 35, an Indian male could very well have diabetes, hypertension, hyperlipidemia. That's a huge problem. So what happens? Again, it could be, it doesn't tell you that, oh, you are in an upper class, you are in the highest socioeconomic status, so diabetes is going to strike you. No, it happens in any socioeconomic status. So if you look at what would happen to a young individual who is in a lower socioeconomic status, and God forbid he has to get diabetes, it is, number one, it is detected late. Number two, it requires extensive care at that time. Number three, it ends up requiring a hospitalization. So what happens? And most of this care, the individual has to pay out of his own pocket. So what happens? Families get into poverty. And that vicious cycle ensues in India all the time, where it is the lower socioeconomic status that is predisposed to the risk factors that lead to non-communicable diseases like diabetes, and it is the treatment of those non-communicable diseases that perpetuates the cycle of poverty. And that creates a problem.
You know, if you look at the European model or the
Right.
Canadian model,
Right.
it is within the means and reach of the governments,
Right.
regardless of federal or local, to have some sort of universal health care provided to its citizens.
Right.
A similar thing is it's also there in India, but obviously for various other reasons which we don't want to go into now.
Right.
You know, it is there, but you know, it could have been so much better.
Right.
What is the hesitation here in the U.S. where you practice
Right.
for this kind of law to take effect?
Yeah, you know, again, it's as you look at what's happened in the U.S. and President Obama was able to finally pass the healthcare legislation, you know, just about a year and a half ago, and it's the Patient Affordable Care Act of 2010. And if you look at what this plan will do is it will increase the number of individuals who will get coverage to almost 94%. So right now we are at 85%. That will increase by almost 10 percentage points, which is great. Now the reason we did not go to the 100% coverage is it would have doubled the cost tremendously. So right now the outlays are such that it will start paying, and the cuts that are coming in certain other sectors, like there are the health insurance companies, the pharmaceutical companies, Medicare cuts and whatnot, will ultimately result in a way that is affordable to bring another 10% into the population, and of course into the coverage limit. And I guess it is changing. The population wants universal coverage. There are certain pockets that are of course opposed to it because the costs are tremendous. Ultimately taxes will go up, and it's a constant battle between the Democrats and the Republicans, and right now as things stand today, the constitutionality of the Obamacare plan is being challenged, and it may go all the way to the Supreme Court whether you can force an individual to buy health insurance. Because the new law makes it that it's mandate that you should buy a health insurance so that the costs are not shifted elsewhere.
It's been a pleasure.
Thank you.
Thank you.
Excellent.